Dr. Apeksha is a physiotherapist by training, and she has over 15 years of experience in physiotherapy. And for the last 5 years, she's been practicing physiotherapy in a primary care setting. Currently, she works with the Purna Clinic in Dang area of Gujarat. And so over to you, Dr. Apeksha. Please, thank you.
Thank you for introducing me, Arpita. Without wasting time, I would like to start my presentation and I would like to share my window. Yeah, just give me a second. Can you see my window?
I
Can you
can
see
see
it?
it. Yeah, I can see
Yeah.
it.
Yeah, okay. So, so outline for today's topic are need of the physiotherapy in rural area, Purna Clinic, which is started by our organization, other physiotherapy clinics run by our trust, training of paramedical workers, and rest of the things what we do. So, need of physiotherapy in rural area. See, we know very clearly that with the increased burden of the musculoskeletal disorders and non-communicable diseases, there is a huge unmet need of physiotherapy in rural area. In urban area, though now physiotherapy services are highly available, and but in rural area, where it is really needed, there is a long gap between the provision of the services. As we all know, that burden of the musculoskeletal is increasing day by day, with the increasing in the age and debility and all. So out of this, if we consider musculoskeletal diseases, then low back pain is the most common thing, and followed by osteoarthritis and trapezitis. Apart from these musculoskeletal disorders, there are many untreated neurological cases like stroke or Parkinson disease and other disorders which requires a continuous rehabilitation as well other services. But unfortunately, the availability of care is not there, and accessibility is also poor. Uh, so with all these things in our mind, we started when we started physiotherapy at the Purna Clinic, which is Purna Clinic is, let me tell you one thing, that it is a comprehensive primary healthcare clinic in rural tribal area of southern part of Gujarat, where the district name is Dangs, and we are located into Morzira, which is a remote village. And we started the clinic in 2022 with the aim of providing comprehensive primary care services. So back then when we started our OPD consultation at Purna Clinic, you can see the number by within 1 year we consulted 1,600 plus patients, and day by day the number of patients are increasing. What we have is a very basic setup where we have electrotherapy, but later on in the course of the clinic, we also add some pediatric physiotherapy services and uh, expanded our services with some other modalities as well. But the unique part of our services is a community-based rehabilitation, which we term it as CBR. Let me tell you a story of one patient. Her name was Suribin. Now you can see on the topmost photo that this is the place where she was living. So when we started the clinic, one fine day, one patient came with the residual functional weakness in hemiplegia after hemiplegia. So what we saw is patient had difficulty in walking and doing routine chores, but then uh, he was never diagnosed, never consulted by a doctor, neither investigations were done nor rehabilitation was provided. Then we were wondering how it is like this, but then we realized that okay, there is non availability of the doctor, rehabilitation services, CT scan services, etc., etc. But the most striking part was there was no availability of the rehabilitation services. Now, as we all know, that rehabilitation is essential component after stroke and or any of such neurological disease. But how you can expect a person who is living in a rural tribal region to travel to you for like say 10 kilometers or 15 kilometers for rehab services? It is not possible, right? So with these things in our mind, we started our home visit. So we realized that there are many factors which were hindering over there. So like difficulty in accessing care, the lack of transportation, and non availability of the family members. Now the problem is the family members are in rural region. Most of the family members are either busy with the farming, or here it is the place where a lot of young people goes for migration to the other part for labor related work. And they also had financial issues. Many times the patient were neglected, and all because all these factors, there was lack of hygiene, and patient was in sometimes in a very bad position in that sense. So when we met this particular patient, she was just lying on the floor. She was not having even the bed at home. She for what do you say, for avoiding urine, and for her toileting activity, she was just moving herself by shifting her buttocks. So in a way, she was living in a very bad position. So when we saw her, we realized that okay, we need to help her. We this is the These are the such cases which gave us the idea of starting our community based rehabilitation services. So CBR program is a team based approach wherein a physician, a physiotherapist, and later we trained our nurses to deliver the rehabilitation services. So initially nurses were trained, but then we realized the burden of the disease. It was very huge and high burden. So we appointed a worker who are trained for CBR, and they exclusively work for providing these rehabilitation services. So for this thing, there are daily visits on pre-decided routes. Services which we offer are physical rehabilitation, delivering the medicines at patient's doorstep, provision of assistive device. I'm coming to that point later, and providing palliative care. So with this, the total CBR home visits from December 2022 when we started to October 2025, which I'm talking, was 4,731 total home visits. So this is how we are emphasizing. We emphasize on these are our workers and family members. You can see on the left side photo that our CBR worker, she is delivering physiotherapy services and training a person with a stroke. Then on the top right photo, you are seeing a spinal cord injury wala patient, to whom the his wife is training him for the rehabilitation, and person herself is doing. So what we do is we try so that the person uh, himself or herself also participate into rehabilitation along with family members also, and our worker. This is how we deliver our program. We have also provided palliative care for CBR patients, where they are having bad sores and rest of other issues related to feeding and pain and other aspects. So along with me and my our nurses and our workers have also been providing palliative care to the patients. Now, provision of assistive devices. This is one of the another unique thing which we are doing is we are providing assistive device. What we have noticed is there are many architectural barrier in rural area. Many times there is no availability of toilets at home, and as we all know that a person with osteoarthritis or a stroke or a hip fracture, say, all of them having difficulty in squatting and uh, doing all routine. This is a very basic routine thing which they face difficulty in doing so. So we have started providing these devices which help them in assisting in mobility, help them in gaining function. They also promote independence, and at the end, there will be improved comfort for the patient and family members for the routine ADLs. So we provide stick, we provide auxiliary crutches, we provide urine port, bedpan, walker, and toilet chair. So this idea of starting other physiotherapy center came after when we had a detailed discussion of our trustees and our and the rest of other members in the organization, and we realized that there is huge unmet need of delivering physiotherapy services to the other part of the dungs. So our organization works into the entire Dang region and adjacent part of the Maharashtra in Surgana Taluka of Nashik district, and in Dhule district some of the villages, which are the adjoining villages of Dang district. So what we started like it we started having clinics into the different areas. Now we have opened 7 such standalone physiotherapy clinics where only physiotherapy services are provided. And recently we have started 2 nurse-learned clinics, which also has a physiotherapy component. So total 9 other physiotherapy clinics apart from the clinic which we have at Murzera. So these are all Sarvamangal Physiotherapy Center at the different centers. And for them we organize all these physiotherapists are trained here at under me at Mozilla uh, for CBR related work and for other services. And also we have at the regular interval we have trainings, and there are different set of practices for monitoring their work as well. So you can see the numbers of other physiotherapy clinics. I'll just briefly state the names of clinic. We have the center at Pimpri, Sakarpatal, Galkund, Shamgahan, Subir, Kalibel, and Malangdev. Uh, Now, Surgana and Umarpata, these are 2 physiotherapy clinics associated with nurse run clinics as well. Out of all the centers, the Surgana place, as we could not start CBR services because their OPD numbers is very huge, and we are yet to start CBR visit there. Now, apart from this clinics, monitoring this clinic and having our own CBR work and OPD work, we also train our paramedical workers who are there with what we call as paramedical workers, and our organization has paramedical workers in each village of the Dangs. So we provide them, we have trained them for basic exercises for low back pain and osteoarthritis, etc. Now, let me talk about the new project COPC, which is we just have started before a couple of the months. COPC stands for Community Oriented Primary Care. Now, this project aims at chronic disease care, surveillance, and access to social benefit. Now, what happens is we have a team sitting at Purna Clinic, and we have a COPC team into the field. Apart from that, we have CBR team. So what happens if a person comes with stroke, right? For example, if I'm seeing into the field, then COPC team will contact a Purna Clinic team and send the patient over there for primary health checkup. And Pune, from the Pune clinic team, we assign our CBR workers for rehabilitation of that particular patient. Now, if a CBR team is there in the field looking after one patient and the person needs social support or any kind of say documentation help or something like that, we will contact COPC team. Or else if we are ourselves like CBR team noticing any patient or having any trouble dealing with the patient at at their home providing rehabilitation services, then then the CBR team will contact the Purna Clinic team, and the team will provide unnecessary medicines or any further checkup or whatever it is advised. So this is how these three teams are linked: COPC team, Purna Clinic team, and CBR team. So, yeah, this is one umbrella under which three teams work together to provide complete and comprehensive services to a patient. So this is an example of this is in Gujarati, but this is how a person from the field is referred to the Pune clinic. Say here it is written the name of the patient, diagnosis, the name of referring person, and to where they are referring. So once with this particular sheet a patient is coming, right, then the clinic team will consult a patient, will check, and further they will send remarks with this to a patient, and person will be assigned for CBR services. This is how everything is linked. So now with this moving forward, so ideas are to how to strengthen this existing care. And right now, palliative care is limited to Pune Clinic team. It is not being practiced at rest of the centers, to rest of the other physiotherapy centers. So to provide and train them palliative care in primary care across all the centers. CBR expansion. So right now, CBR delivery is through our CBR workers, but in future, which we COPC team, the workers of the COPC team at village level, we call them HA workers. So this delivering this CBR services through the HA workers so that they get rehabilitation services at their own doorstep. Orthotics facility at all centers, organizing camps and regular follow-ups with the patients, providing institutional facility to the neglected patient. So building up a hospice or connecting with other organization. So yes, this is what we are thinking for our future. So this is a lovely photograph, which I think this is the whole team. This particular photograph was clicked when we were for a home visit of a particular patient, and which I feel that um, this work, what we are doing, the physiotherapy thing, CPR, and working with the different centers and uh, dealing with their medicines and palliative care and etc is not possible if we don't work in a team. So here the entire team is sitting together and having food. So with this, I would like to end my session. I would invite any questions if it is there. Thank you.
Thank you, Dr. Apeksha.
Yeah.
Thank you for the lovely session. Yeah.